Hello, my colleagues. A very warm welcome. We're going to continue discussing important questions related to VTE guideline. Number 7. We have a 38-year-old woman who's grabbed a 5 para 4 with a BMI of 32. She attends consultant-led antenatal clinic at 28 weeks gestation. She is otherwise well with no medical comorbidities, and she takes a routine antenatal supplements. Fetal growth scan today has been normal. According to the RCOG guidance, what is the most appropriate VTE prophylaxis for this woman? So remember here she has 3 low risk factors with a score of 1 each. The first one is her age, more than 35. The second is a parity, more than or equal to 3. And the third is a BMI, more than 30, which gives a total score of 3. For someone with a score of 3, will need antenatal thromboprophylaxis from 28 weeks of pregnancy, and once we commence them on antenatal thromboprophylaxis, they continue to receive it for 6 weeks postpartum, making option B the correct option. What are the low risk factors and how do we score them? We give a score of 1 to each of the following low risk factors. First, obesity with a BMI of more than or equal to 30 kg per meter square, age more than 35 years, parity more than or equal to 3 pregnancies, smoker, gross varicose veins, which means they are symptomatic, above knee with associated edema or skin changes, immobility more than or equal to 3 days, multiple pregnancy, current preeclampsia, IVF pregnancy, and remember here they have a 4-fold increased risk of VTE in the first trimester, unlike those with natural conception where the risk of VTE is highest in the first 3 weeks postnatally. Family history of unprovoked or estrogen-provoked VTE in first-degree relative, and low-risk thrombophilia. If the total score is 4, they will need thromboprophylaxis with low molecular weight heparin throughout the antenatal period, and they continue to receive 6 weeks postnatally. If the total score is 3, then they will need prophylaxis only from 28 weeks of pregnancy, and again they continue to receive 6 weeks postnatally. If the total score is between 0 to 2, then they only need prophylaxis if they get admitted to the hospital. We will discuss more about this guideline during our course. Thank you for your time and have a good day.